Good morning, friends. Welcome to our next learning session. And as I have been telling you, that smoking affects practically every organ and system of the body. I have told you already the effects of smoking on the bone, the effects of smoking on the sexual health, on gastrointestinal tract, and today I am going to talk about the effects of smoking on cardiovascular system. To understand the effects, first you must understand the heart itself. Look at this diagram to understand the heart. This is the X-ray of chest. You see, what do you find? You find that this shadow is the heart shadow. This is the heart shadow. This is from this end to this end. It is marked with a red line. This is the width of the heart. And what you see, this blackish area, this is the two lungs, one on right side and the other on the left side. These are the collarbones, and this blackish area is showing air in the windpipe. This is the front bone, which is called the breastbone or sternum. This is the sternum. This is the partition between your chest and the abdomen, that is the stomach area. This is called diaphragm. This is, you can clearly see these things, and this is how the level of for measuring things, these are how we make the level. Now let us see another diagram. See, what do you see in this diagram? In this diagram, this is the heart, and from the heart is arising this aorta. This is the front part. This aorta is arising from the heart. Bringing close to the screen, see now it is arising from the heart and going up and then turning to left and down. It is going to the back of the heart, and then it will emerge from here and go like this here into the stomach area. So from here, where the aorta arises, two arteries are rising, one on the right side, right coronary artery, and the other on the left side, that is the left coronary artery. Left coronary artery is small, about 1 centimeter long, and then divides into two, one coming on the front, that is the left anterior descending coronary artery, and the other is going to the back, that is the left circumflex artery. Now the rest of the things here we are not at present concerned, but important thing to remember is that there are three coronary arteries, one right coronary artery, one left, which divides into left anterior descending and left circumflex coronary artery. These are the arteries which carry blood to the heart for its normal functioning. Say, what can smoking do to your heart? Remember, friends, smoking is very important cause of cardiovascular disease. It is called CVD, which means cardio means heart, vascular means blood vessels, and disease. So disease of the heart and blood vessels is called the cardiovascular disease. The smoking plays very important part. The smoke contains nicotine and other toxic materials and various chemicals. They are in thousands actually. They damage the cells, they damage the arterial wall, they increase the plaque formation, and they accelerate the process of atherosclerosis. Atherosclerosis is the thickening and hardening of the arteries. The composition of blood is also changed. The blood becomes thicker and blocks the arteries easily. That is, it forms clot inside the arteries. And when it totally blocks the artery, then the portion next to this part would not get sufficient blood supply. and therefore be deprived of oxygen, and that portion will become dead, and that is what is called the heart attack. Very dangerous. Anything can happen. The heart attack may start and immediately the person may die. Or person may be lucky enough that he survives this initial episode, reaches in time to the hospital and gets the proper treatment. But what is more important, we have been hearing and listening over a number of from our school to our present age, that prevention is better than cure. So if we know that smoking causes this problem, then we must stop smoking. Remember friends, smoking causes 25% of deaths because of related to the heart are because of smoking. So it is very important to quit smoking. Smoking can cause, as I said before also, constriction of the coronary arteries. It can cause the hardening of the arteries. Arteries become less flexible. So when they need to increase the blood supply, they have to open up their lumen. That is, they have to dilate. That dilate means they have to relax and open up the lumen. But these arteries have become hardened. They do not open up, and therefore the blood supply is not increased. So smoking itself causes constriction of the coronary arteries, decreases the blood supply to the heart. Moreover, smoking causes accelerated atherosclerosis, which further leads to problems, and it also changes the composition of blood, leading to plaque formation, thus obstructing the blood flow in the coronary arteries. So smoking is very important in women, particularly above the age of 35 years, particularly those women who are using birth control pills. The deaths are more common in them than compared to those who are not smoking. So smoking is very important contributor factor to atherosclerosis, to the blockage of arteries, to this also weakens your heart and can increase the symptoms of your congestive heart failure. So remember that also, that heart failure can also be increased by smoking cigarettes. Those who do not smoke, they can also get the problem because of the second-hand smoke, from if they are sitting near the smoker or if somebody is sitting in the same room and smoking. Since the air will contain the exhaled nicotine that is inhaled by the other normal people, then it will cause the problem. The important point is that one must quit smoking. And what happens if you quit smoking? Within 1 year, your risk of heart attack or cardiovascular death is reduced significantly, and after 5 years, you hardly have any risk. I mean, its risk is as much as in non-smokers or those who have never smoked. So that is even 5 cigarettes per day can cause the problem of increased cardiovascular death. Heart attacks have been said to be 3 to 4 times are more common than in smokers than in non-smokers. Therefore, it is important that you, if you are smoking, quit smoking. You can get yourself tested by an electrocardiogram, and if you ask a more foolproof method, you can get an echo done for your heart. And these two tests, ECG and echo, put together give you a lot of information about your heart ailment. Now, what diseases can smoking cause? It can cause coronary artery disease, of course we have just talked of. It can cause stroke, it can cause peripheral arterial disease, it can cause aneurysm of the aorta. Now here I want to show you this diagram. See, this is the normal aorta. This is the normal aorta rising from the heart, taking a turn, going to the left side and behind the heart and going to the stomach area. This is normal aorta. You see, from uniformly normal. And what has happened here? Here a balloon has formed in the aortic wall. This balloon, which I am marking with my pencil, this is called aneurysm of the aorta. Since this is a part in the chest, this is called aneurysm of the thoracic aorta. And if it is the part in the stomach area, then it is called the abdominal aortic aneurysm. This is also aneurysm of the aorta, but this is in the abdomen. Now, what happens when you see this artery by smoking? Smoking causes constriction of the coronary arteries like this, and here the flow of blood will become drastically reduced, and therefore there are more chances of this blood getting clotted here and blocking this portion completely. So this is very important to understand that smoking can do this type of harm to our body. Now, as I said before also, that if you stop smoking, you can reduce your risk of this thing. In the peripheral arteries, for example, we said that the person may even develop gangrene because of less blood supply to your feet, and the part has to be amputated. So these are the drastic things which can happen just by for your pleasure of smoking a cigarette. Smoking can cause nausea, vomiting, diarrhea, and it does give you a little euphoria, but for that euphoria you need not take such a big risk. So friends, if you have been smoking and did not know the risks of smoking, now you are fully aware of how dangerous it is, and the earlier you stop, the better it is. The smoking, the cardiovascular disease is related to the number of cigarettes you smoke. If you are a heavy smoker, you have more risk. If you are light smoker, you have lesser risk. But there is a definite risk with these things. Smoking is definitely harmful, and if you see your incidence of stroke is also 7 to 8 times more common in smokers, because the arteries to the brain also become less. So this I have told you in the effects on the cerebrovascular system. Here I am talking mostly concerned to the heart itself. So friends, take precautions, do not smoke, and if you are smoking, stop smoking. Within 1 year you will find the difference that your risk has drastically dropped, and after 5 years you are as good as non-smoker. So friends, next time we will meet with another interesting talk on these subjects like this. And here I may remind you that I had reported 2 cases. They are mentioned in my book also, of aneurysm. One case which had come to AIIMS in the chest clinic. I had seen it. It was there was an opacity in the para-aortic region. It is actually pericardic region, right pericardic region, and this was proved to be aneurysm of the ascending aorta, ascending thoracic aorta, and this patient was taken for operation, but unfortunately his aneurysm ruptured on the operation table and patient died. This is unfortunate, but that this incident occurred in somewhere in 1969. Therefore, the science has changed a lot from that time onwards. I have described another case of abdominal aorta where there was a big lump in the abdomen, and this was pulsatile. These pulsations are expansile. These are not just transmitted pulsations. There is a difference between the transmitted pulsations from over a mass or they are really from a blood vessel. Expansile means that the expansion occurs in all directions. In transmitted pulsations, the movement is only in up and down direction. But when we say it expands means lumen expands in all directions, therefore the pulsations are felt in all directions. There is a, of course, clinical method. This is for the doctors who are paramedicals to understand this thing, but for laymen it is not important because they are not going to examine the patient. For all of us, the common thing remains that smoking is very dangerous. Smoking can cause changes in the blood composition. Smoking can cause thickening of the arteries. It can increase the blood. It can cause blood to thicken and block the arteries more likely. Thank you very much. See you next time with another interesting topic.